How are you
topics
feeling with
in our-
PD classes?
Sir, your classes, I thought I can do it well without having any classes. But after I attended your classes, I thought we know everything, but we are very we actually doesn't know how to deliver it on a proper manner. What that opposite person is expecting.
Right.
That I have learned. So now I'm thinking I'm a little bit weak of my medical subjects, but the remaining thing and the body gestures and everything I came to know. So that is like that gives me a confidence of around 60%, sir. The remaining 40 medical things I have to cover and I have to go through. And I definitely recommend your class, sir. I came to know everything, and that last that video, what you have sent, that Brahmastra, that means that what we say, it's a mantra. It's a mantra to crack the interview. So that was wonderful, sir. My experience is best with the classes, and I hope I will clear that interview and I will get
I
selected.
promise you will. Don't worry.
Thank you.
How do you find the Brahmastra?
Sir, that is something different. Actually, I was in the hospital, so I was not able to finish it properly. I came just 10 minutes before. So then I wanted to attend your classes right away. Yeah, then today and tomorrow I have to do that all the medical things, sir.
As many times you listen Brahmastra, you will find new thing, new point in your brain. Sure. So don't listen it once. Listen it some other times, many times. And if any person you found going for any interview, he is a good person and really deserves to be a doctor, you can give it. Yes. I don't have any problem. Okay? You can give to any good person. No problem.
Yeah.
But Brahmastra is my ultimate thing, because in interview, I may not be with you. My work is almost getting finished now. The Brahmastra is the thing which will remain with you up to your interview. And it will teach you how to handle interview. Don't worry.
Okay, sir. Great. I'll go through it, sir. And through the traveling time also I'll listen.
And doctor, before starting my medical portion with you, I took an interview and always challenge doctors that you gain 50% marks in my interview. And believe me, till today, no doctor has achieved 50% mark, 20 marks, 30 out of 100. So you like that interview which I took personally before giving my medical portion to you people?
Yes, sir.
All the questions are from AMC only, not from my side. From last 15 years, whatever I feel are important, I ask from you people, and I challenge 50 marks very hard. 50% marks are very hard to gain.
Yes, sir. Your hard work and the people also gave that questions, and that will be very helpful, sir. From morning, I was going through the questions one by one. Everything, sir.
Yesterday, I took an interview of one doctor. I told you are an MPPS, 5 years you spent. I'm going to take your interview. I'm giving you 1 day. She told, okay. Then I'll start my medical portion with you. She told, okay, sir. And I told you have to gain only 50% marks. She told, okay, sir, no problem. And believe me, after the interview, I told, now you tell me how many marks you get out of 100. She told, sir, 20, 25. First, my question is, your name is very unique. So what does it mean?
Sir, my name is, it's mean Lord Vishnu's name, sir. One of the name, they'll call it as in Andhra Pradesh. Yes, sir. Where that Lord Vishnu is sitting on the mountain, they call that one as Tirumala Tirupati. So my name is Tirumalai. And my father and mother kept this name as my grandfather's name, sir. His name is Tirumalai Swami.
You belong to which place?
Sir, I belong to Tirunelveli, which is located in down south Tamil Nadu, sir.
Yes, okay, sir. Now you tell me, you are going for army. So what is your first preference, army, navy or air force?
Sir, first preference will be army, then air force and navy, sir.
Okay. What is the motto of AMC?
Sir, Army Medical Corps motto, Sarve Santu Nirmaya. May all free from disease. May no one suffer.
You are having any experience of job or you are fresher?
Sir, I have a salubrious experience of working as a medical officer in 2 clinics and 1 corporate hospital, which is located in Tirunelveli for almost 3 years, sir.
So with your tenure of 3 years, what type of patients you have seen? What type of emergencies you have handled?
Sir, during my tenure, I have seen cases of MI and stroke, and also some burn cases, and most of the cases of fever, and also the RTA cases, the road traffic accidents. Yes, sir.
One question was asked from one of my students recently, management of MI. Please answer this question.
Yes, sir. First of all, we have to take the ECG, sir, and then with the ECG, we cannot come to the conclusions, and we have to send, if the patient has come to the hospital within 24 hours, then we have to send the drop T and drop I, and we have to send CKMB, and we have to right away start the sublingual nitroglycerin, sir, to relieve the pain. And the next thing, if we have to check the vitals, sir, if the blood pressure is very low and all, we are not supposed to start the nitroglycerin infusion and proceed to the next management. We have to give aspirin 325 mg right away and clopidogrel 300 mg if the age of the patient is less than 75, and if the age is more than 75, we have to give 75 mg and atorvastatin 80 mg. Yes, sir. And we have to proceed further whether we have to thrombolize the patient or we are going to do the percutaneous coronary interventions. And if the patient came late, and we can proceed with the thrombolysis, that injection streptokinase 1.5 million units over 60 minutes, sir. Or the alternative will be tenalactase. Yes, sir. And the one thing I forgot, sir, we have to give, we are not supposed to give NSAIDs to the MI patients. So we have to give morphine, that opioids, for the pain relief, 5 mg IV slows.
Okay. Yes. Name any selective NSAID?
Sir, we can give
Etoracoxib. Etoracoxib is selective NSAID.
Yes, sir.
Okay, now you speak on abortion.
Abortion. Sir, actually, if the female is pregnant, we have to confirm within 45 days. And during the 3 trimesters, the first trimester is the very important one. There is a high chances of having abortions. And we have to do the antenatal care every month to follow up with the cases. And there are types of abortions, complete and incomplete and closed and inevitable, and the complete abortions, and the remaining things will come to know through the signs of bleeding. So bleeding is the main thing. We cannot leave it as it is. So we have to take it into the serious, and we have to do the transvaginal sonography to confirm the conditions, and we have to do the examinations, cervical examinations, pelvic examination. Yes, sir. And in that abortions, there will be a cervix closed type and the open type. Sir.
About Smith fracture. Yes. Smith fracture.
Smith fractures. Sir, it is.
Yesterday, this topic was asked. Okay, so go through this topic.
Fractures is left, sir. I will go
Smith topic. Smith fracture.
Okay. Sir.
Now tell me about Colles fracture.
Sir, Colles fractures will.
So again, this question was asked from Sarthak. He got selected. So okay, I want that you should answer. Questions are repeated.
Okay, sir. I'll go with this fractures and everything, sir.
Okay, tell me about cardiac and pleuritic pain. Difference between cardiac pain and pleuritic pain.
Sir, cardiac pain, the patient will have the pain on the pericardium, that area, that will radiate to the shoulder, jaw, and the neck. And the pleuritic pain, we can come to through, we should ask the patient to inhale and exhale. The pleuritic pain will be on during the inspiration and expirations. We can differentiate like this, sir. The cardiac pain will be there for still.
Okay, tell me about whiplash injury.
Sir, whiplash injuries, it will happen around the car accident, sir. That sudden movement of the neck through the front and back. So at that time, there is high chances of having a whiplash injuries, and it will be like electric shock that will radiate through the spinal cord. There is high chances of having these kind of things through the during the accident, sir.
Tell me about cold chain.
Cold chain will be using for this vaccine. Sir, I cannot answer. I'll just
See, I
go through
have
it, sir.
to be very different in interview. Okay, can't be soft
Yes.
with you.
Yes,
Now
sir.
you tell me about balance sign.
Balance sign, sir. We'll doing the test to detect if there is any compression over that retina column, sir.
Its indication are dullness to persecution in the left flank LU and shifting
Okay.
dullness to persecution in the right flank seen with splenic rupture.
Okay, sir. Balance, sir.
Okay, tell me about Kehr's sign. Kehr's.
Okay, same. So no idea, sir. I will read about it, sir.
Pain. Kehr's sign as pain referred to the left shoulder on gentle palpation of the abdomen
Okay.
when a patient is lying down with legs elevated.
Excellent.
Splenic
Okay,
rupture,
sir.
classically associated.
I'll read the topic, sir. Splenic
No need
rupture.
to read, just glance.
Just
Enough.
okay, sir. The right.
Okay. Okay, now you tell me about the side effects of quinine.
Choline. Side effect of choline, sir.
Quinine.
Quinine. Sir, quinine, there's a high chances of having seizures. The quinine side effect.
Okay. Blurred vision, ringing in the ears, hematuria, confusion. Okay, how you handle hematuria?
So hematuria. We have to ask the patient's history.
Okay.
And how long he is having problem, and we have to do the kidney punch test to rule out if there is any nephrolithiasis, and if the stone or something is lodges to the urinary bladder, there is a high chances of having a hematuria. So we have to send a urine protein and also ASD deposit, and if there is a confirmation of the RBCs in the urine proteins, we have to give him an antibiotic. And also we have to send the urine culture test sensitivity, and we have to start the antibiotic. And if the bleeding is heavy and all, we can give tranexamic acid 250 mg twice a day for at least 2 days. And we have to advise them to go under ultrasonography of abdomen and pelvis to evaluate further, sir.
Okay, tell me about heart sounds.
So there are 4 heart sounds: S1, S2, S3, and S4. And S1 during the systolic phase, sir, and S2 will be having a diastolic phase. And usually we won't hear S3 and S4. That S3 will be end systolic blood pressure, that sound, and S4 will be end diastolic sound, sir.
And S4 sound is almost always pathologic.
Pathology.
So anything, Dr. Thirumalan, you want to add in my course, you want to help for so that next your juniors may get benefited like we are giving a 1 week session and 1-to-1. I'm trying my best to give the best. But anything you feel, sir, this also you give, it will benefit to others. This also you should add. Any point you want to add something from your side?
Sir, actually, what I felt, I never expected that these people will send me the call letter for that interview. But I just simply applied, sir. Then it came. So from that time onwards, actually, I don't have any idea like how should we proceed and how we have to go further and all. Then I found everywhere I search, I like end up with your name only, sir. Every platform. So you are the only one I know that who is giving a complete guidance for the AMC and everything. So what I suggest, sir, half of the people doesn't know. We have to do a little marketing in the social platforms and all. That could be the great one to find out the more people, sir. Actually, very few people have come to know that you are guiding and you are having these kind of classes and all. That half of the people doesn't have any idea. They have prepared and they have going directly for that. And the classes, whatever you are going, that way also wonderful, sir. Because you are starting from the introduction, then you are giving one by one, then body language. At the end, you are before giving medical questions, you are you are taking an interview, then you are correcting. So it is like you are traveling till the end, and the students should make you proud. I think I will make you, hopefully. And this is good, sir. And after, if I get selected and all, then I can tell my juniors also. So many people doesn't have any idea how to proceed further. I hope I'll guide them. Yes, sir.
I promise. I'll make it successful.
Thank you.
My promise.
Yes, yes, sir.
Oh, doctor, go ahead. My best wishes to you. Okay, whenever
Sure.
next time you want to talk, you want to give interview, you want to take any help, you can. Okay.
Yeah.
Just
Sure,
give
sir.
me a message and we'll adjust something for you.
Yeah, sure, sir.
And as per your convenience, promise.
Okay, sir. Okay,
Best
sir.
of luck.
Sir,